Hello, my name is Dr. Dewan S. Raja. Today I will discuss about dorsal foot muscles and tendons on the dorsum of the foot. On the dorsum of the foot, we have two intrinsic muscles. One is the extensor hallucis brevis, another one extensor digitorum brevis. Brevis means short, so it inserts the proximal phalanx and also dorsal hood or dorsal aponeurosis. Extensor digitorum brevis, again it is short, it goes to the middle phalanx and also the dorsal aponeurosis. We have extrinsic muscle tendon. These are the tibialis anterior tendon. This is the tibialis anterior. This is the synovial sheath. Then we have the extensor hallucis longus. Longus should go to the distal phalanx. Okay. And here tibialis anterior will be inserted to the medial cuneiform and first metatarsal junction. Here extensor digitorum longus, that will be inserted to the distal phalanx of the second, third and fourth toes, also the fifth toes, along with the dorsal aponeurosis and the dorsal hood. Fibularis tertius, this is the fibularis tertius muscle, okay, that will insert to the dorsum of the base of the fifth metatarsal bone. Okay, this has common synovial sheath along with the extensor digitorum longus. So these all are extensor muscles. They will cause dorsiflexion of the foot. And the brevis will not go to the distal phalanx. Hallucis brevis, extensor hallucis brevis will be in the first phalanx, the proximal phalanx of the great toe. Extensor digitorum brevis tendon will go to the middle phalanx. Both the cases, they will also insert to the dorsal hood or the dorsal aponeurosis. Okay. Okay, so these are the origin of the extensor digitorum brevis, anterior part of the superior surface of the calcaneum, deep surface of the stem of the inferior extensor retinaculum, insertion tendon of extensor digitorum longus, plus insert to the middle phalanx of second, third and fourth toes. Nerve supply, deep fibular nerve. Deep fibular nerve is a branch of the common fibular nerve. Common fibular nerve is a branch of the sciatic nerve. Action, extension of the metatarsophalangeal joints and interphalangeal joints of second, third and fourth toes, particularly in dorsiflex foot. Extensor hallucis brevis, origin is same place in common with the extensor digitorum brevis. Insertion, dorsal surface of the base of the proximal phalanx of the great toe and also to the dorsal aponeurosis or dorsal hood. This also insert to the dorsal hood and dorsal aponeurosis, plus this goes to the middle phalanx in the proximal part. So nerve supply, deep fibular nerve. Action of the extensor hallucis brevis aids in extensor hallucis longus in extending the great toe at metatarsal phalangeal joint. Okay, you can say at the first metatarsal phalangeal joint. First metatarsal phalangeal joint. Okay, the brevis, we got that. Here is the muscle extensor hallucis brevis going to the proximal phalanx, also to the dorsal hood and dorsal aponeurosis. Here extensor digitorum brevis going to the middle phalanx base, also to the dorsal hood or dorsal expansion. Okay, and this is the muscle. These are the two muscles. One is this, another one is this. These are intrinsic muscle. They are on the dorsum of the foot. This is a schematic presentation here. This is the insertion of the extensor hallucis brevis. These are the insertion of the extensor digitorum brevis. Okay, to the second, third, and okay, we got there. To the second, third, and fourth toes will go to the middle phalanx. Plus, they also insert to the dorsal aponeurosis or dorsal hood like this. This is going to the proximal phalanx. They are going to the middle phalanx base. Okay, we'll find out some blood vessels in relationship to that of the tendons. Okay, here is the deep fibular nerve. It supplies all the muscles on the dorsum of the foot. It supplies the tibialis anterior, extensor hallucis longus, extensor digitorum brevis, extensor digitorum longus, extensor digitorum brevis, as well as the and also the fibularis tertius muscle. Fibularis tertius muscle. This is the tendon of fibularis tertius that is also getting innervation from the deep fibular nerve. This is superficial fibular nerve. This is here, it is cutaneous. It supplies the fibularis longus, fibularis brevis. Will not go there. Okay, and the blood vessel nerve, the deep fibular nerve and the dorsalis pedis artery, they are present between the tendon of the extensor hallucis longus and extensor digitorum longus. You have to remember that. And dorsalis pedis artery is a continuation of anterior tibial artery. The deep fibular nerve is a branch of the common fibular nerve. Okay, so we got the tendons. Again, let us summarize. We have the intrinsic muscle tendon, extensor hallucis brevis, extensor digitorum brevis. Extrinsic, these are the intrinsic muscle, and they are small tendons. We have the long tendons of the muscle which are coming from the tibia and fibula from the anterior aspect underneath the superior extensor retinaculum and the inferior extensor retinaculum. These are the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius. And blood vessels are present between the tendon of the extensor digitorum longus and the extensor digitorum longus and extensor hallucis longus. And the artery here, it is covered by the tendon of the extensor digitorum brevis. We are looking, artery is covered by that, and the nerve is over the tendon, this tendon. This nerve is the deep fibular nerve. Okay, we got that. And this is the superficial fibular nerve. It provides most of the dorsal area cutaneous innervation. This first inter-toe area, the cutaneous innervation is carried by the deep fibular nerve. All the muscles are innervated by the deep fibular nerve on the dorsal, including the fibularis tertius. And that's all about the muscles and tendons of the dorsum of the foot. If you have any question, please feel free to ask me. Please share the information with your friends. Please subscribe me. Please support my channel. And have a nice and wonderful day. Bye now.